Welcome to this pharmacology quiz in the Quick Pharmacology Test Series. In this video, we will test your knowledge of anti-TB drugs used to treat tuberculosis and other mycobacterial infections. This quiz contains 10 recall-type multiple-choice questions designed to challenge your understanding of key pharmacology concepts. Each question includes 5 options, followed by the correct answer and a brief explanation. After every question, the video will pause briefly to allow you time to think and choose your answer before the correct option is revealed. So, let's get right into it. Question 1. Which mechanism of action correctly describes the primary antibacterial activity of first-line antitubercular therapy? Option A. Inhibition of arabinesyl transferase in mycobacterial cell wall. Option B. Inhibition of mycolic acid synthesis in mycobacterial cell wall. Option C. Binding to 30S ribosomal subunit preventing protein synthesis. Option D. Inhibition of DNA gyrase causing DNA replication failure. Option E. Inhibition of folate synthesis through dihydropteroate synthase. The correct answer is option B. Inhibition of mycolic acid synthesis in mycobacterial cell wall. This is because the key first-line drug isoniazid inhibits synthesis of mycolic acids, essential components of the mycobacterial cell wall. The other options describe mechanisms belonging to different antimicrobial classes rather than the principal mechanism of first-line anti-TB therapy. Question 2. Which of the following statements about rifampicin pharmacology and mechanism of action is correct? Option A. It inhibits RNA polymerase and blocks bacterial RNA synthesis. Option B. It blocks arabinesyl transferase during mycobacterial cell wall synthesis. Option C. It interferes with folate metabolism in susceptible microorganisms. Option D. It inhibits mycolic acid synthesis through CATG activation. Option E. It binds the 30S ribosomal subunit and prevents translation. The correct answer is option A. It inhibits RNA polymerase and blocks bacterial RNA synthesis. The explanation is that rifampicin binds bacterial DNA-dependent RNA polymerase, preventing transcription and therefore inhibiting RNA synthesis. All other options describe mechanisms belonging to different antimicrobial drugs such as ethambutol, sulfonamides, isoniazid, or aminoglycosides. Question 3. Which antitubercular drug is most strongly associated with dose-related optic neuritis? Option A. Isoniazid. Option B. Rifampicin. Option C. Pyrazinamide. Option D. Ethambutol. Option E. Streptomycin. The correct answer is option D. Ethambutol. This occurs because ethambutol can cause dose-related optic neuritis resulting in decreased visual acuity and red-green color blindness. The other listed drugs produce different characteristic toxicities rather than optic nerve damage. Question 4. Which second-line antitubercular agent belongs to the fluoroquinolone class and inhibits DNA gyrase? Option A. Ethionamide. Option B. Amikacin. Option C. Levofloxacin. Option D. Cycloserine. Option E. Pyramidosalicylic acid. The correct answer is option C. Levofloxacin. The reason is that fluoroquinolones such as levofloxacin inhibit bacterial DNA gyrase and topoisomerase 4, disrupting DNA replication. The remaining options represent other second-line agents that belong to different drug classes with distinct mechanisms. Question 5. Regarding adverse effects of anti-TB drugs, which of the following statements is incorrect? Option A. Isoniazid commonly causes peripheral neuropathy through pyridoxine depletion. Option B. Rifampicin strongly induces hepatic cytochrome P450 enzymes. Option C. Ethambutol commonly causes irreversible renal cortical necrosis. Option D. Pyrazinamide may increase serum uric acid concentrations. Option E. Streptomycin may cause vestibular and auditory toxicity. The correct answer is option C. Ethambutol commonly causes irreversible renal cortical necrosis. This means that option C is incorrect because ethambutol is mainly associated with optic neuritis rather than renal cortical necrosis. All the other options describe well-recognized adverse effects of their respective antitubercular drugs. Question 6. Which statement about isoniazid pharmacology and clinical use is correct? Option A. It is active only against extracellular Mycobacterium tuberculosis organisms. Option B. It requires bacterial CatG enzyme activation inside mycobacteria. Option C. It primarily inhibits arabinogalactan polymerization in the cell wall. Option D. It prevents bacterial DNA gyrase from relieving supercoiling. Option E. It binds to ribosomal 50S subunits inhibiting peptide elongation. The correct answer is option B. It requires bacterial CatG enzyme activation inside mycobacteria. This is because isoniazid is a prodrug activated by the mycobacterial CatG catalase peroxidase enzyme before inhibiting mycolic acid synthesis. The other options describe mechanisms belonging to different antibiotics or antitubercular drugs. Question 7. Which drug used in tuberculosis treatment is an aminoglycoside antibiotic? Option A. Streptomycin. Option B. Isoniazid. Option C. Pyrazinamide. Option D. Ethambutol. Option E. Rifampicin. The correct answer is option A. Streptomycin. This is because streptomycin is an aminoglycoside antibiotic that inhibits protein synthesis by binding the bacterial 30S ribosomal subunit. The other listed drugs belong to different pharmacological classes used in tuberculosis therapy. Question 8. Which clinical pharmacology principle best explains the use of combination therapy in tuberculosis treatment? Option A. It prevents emergence of resistant Mycobacterium tuberculosis mutants. Option B. It reduces hepatic metabolism of antitubercular medications. Option C. It eliminates need for prolonged treatment duration. Option D. It prevents optic neuritis associated with ethambutol. Option E. It completely removes hepatotoxicity risk from therapy. The correct answer is option A. It prevents emergence of resistant Mycobacterium tuberculosis mutants. The explanation is that combination therapy reduces the probability that resistant bacterial mutants will survive and multiply during treatment. The other options incorrectly suggest pharmacokinetic or toxicity benefits that combination therapy does not reliably provide. Question 9. All of the following statements about pyrazinamide pharmacology are correct except Option A. It is particularly active in acidic intracellular environments. Option B. It contributes to shortening the intensive TB treatment phase. Option C. It frequently causes hyperuricemia through uric acid retention. Option D. It inhibits arabinosyl transferase in mycobacterial cell walls. Option E. It may cause dose-related hepatotoxicity during therapy. The correct answer is option D. It inhibits arabinosyl transferase in mycobacterial cell walls. This occurs because inhibition of arabinosyl transferase is the mechanism of ethambutol rather than pyrazinamide. All the other statements correctly describe recognized pharmacological properties or adverse effects of pyrazinamide. Question 10. Which antitubercular drug primarily inhibits arabinosyl transferase, impairing mycobacterial cell wall synthesis? Option A. Pyrazinamide. Option B. Ethambutol. Option C. Rifampicin. Option D. Isoniazid. Option E. Streptomycin. The correct answer is option B. Ethambutol. This is because ethambutol inhibits arabinosyl transferase enzymes involved in the synthesis of the mycobacterial cell wall component arabinogalactan. The other drugs act through different mechanisms such as inhibiting RNA synthesis, mycolic acid synthesis, or bacterial protein synthesis. The quiz is now complete. and thank you for taking part in this anti-TB drugs pharmacology challenge. Don't forget to drop your score in the comments so I can see how you performed. For deeper understanding, consider reviewing Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary. Any treatment guidance referenced in this video is aligned with recommendations from the BNF. If you found this helpful, be sure to subscribe for more pharmacology quizzes and learning content.